Good morning, good afternoon, good evening, wherever you are. And thank you for joining this webinar session on risk and mitigation strategies for managing COVID-19 vaccines in the supply chain and CCE strategies used. This session is interpreted in French and Spanish. Please click the globe at the bottom of the window and select the desired language. We are also recording this session, and we will share with all participants the links to the webinar materials next week. During this presentation, don't hesitate to ask your questions anytime in the Q&A box. Please check at the bottom of your window, and you can use the Q&A box to ask your questions. We will answer these questions at the end of the session after the presentation. In the meantime, I'm happy to welcome Michel Seidel from UNICEF, Nora Lucia Rodriguez de PAHO, Pablo Llopis from UNICEF, and Dr. Leonardo Pealta, specialist in health service management and epidemiology. I'm going to share my screen now, and I'm going to give Michel the floor. Michel, over to you.
Super, thank you so much. And good morning, good afternoon, and good evening, wherever you may find yourself today. So as indicated, we're going to be chatting a little bit today, and I'm going to be presenting just a little bit on the strategies that we have suggested on managing COVID-19 vaccines. And then later on, we're going to see some practical examples from PAHO and from our regional office in La Croix, as well as a presentation from Nicaragua on cold chain strengthening activities within countries. So if you can move to my presentation, please. Yeah, so we've had a look at some of the mitigation strategies we've seen in countries. So in the next slide, we had seen that with large shipments coming into countries, there was a large amount of pressure, particularly on cold chain systems, but distribution systems, etc. Also, we've also seen even now that shelf life is an additional risk. So really an effective COVID vaccine rollout requires that cold chain systems are supported by increased demand and uptake, effective vaccination planning and rollout, good stock management planning, and effective distribution systems. So in the next slide, the purpose really of some of the support was really to raise awareness around the complexities and considerations around arriving COVID-19 vaccine shipments, really within the context of cold chain space and high volume of shipments, with particularly where we are seeing low absorption rates and utilization rates within countries. So next slide, please. So I've indicated, we're seeing an increase in supply of deliveries, a lot of pressure for countries to accept vaccines, a lot of bilateral agreements, in distribution, low challenges within countries, low absorption rates, and this is resulting in cold chain capacities being constrained within countries. And then we're also seeing longer lead times for cold chain to be placed within countries due to global supply chain challenges, and the availability of cold chain, the delivery and the commissioning is also thereby affected. So in the next slide, we had mitigation strategies that we had recommended. So vaccine supply should be demand driven, so really linked to that absorption rate, and there should be a plan for managing shipments using the existing vaccine storage capacities. Also see that there are certain supply chain interventions that we need to have, so calculating and secure storage capacities for RI stocks. We've seen we have seen that RI coverages have slumped, and we do need to make sure that we are boosting those as well. And we need to ensure cold chain space is available at the national level for upcoming shipments of COVID-19 vaccines, as well as that there's good distribution planning. Alternative storage solutions, looking at, and many countries have done this as well, renting private cold chain storage, as well as refrigerated containers like reefers, etc. Next slide, please. So one of the things I want to stress as well is that walking cold room site readiness is critical. We're still deploying a large amount of cold rooms as UNICEF, but I'm sure other organizations as well. And that has been a challenge ongoing. This data is not that up to date, but we are still have a number of challenges in terms of getting those sites ready for that installation. So the types of challenges we're seeing is varies from place to place, but really it is completing those assessments on time and getting those operational deployment plans from countries. So just want to flag that that is an important part of managing these shipments and so on as well, and getting that complete storage situation. Next slide, please. So in terms of estimating the cold chain space needed at national level, we need to have a look at the storage volumes, and we provided some guidance in terms of what needs to be done. And the WHO sizing tool would be a good tool to use in terms of estimating these storage volumes, and then looking at your framing your COVID vaccine and the storage capacities depending on the temperature storage zones per vaccine as well. I have them here, but we can supply this information as well, and it is available in the tool additionally. Next slide. So when we look at how much cold chain space is needed at the national level for your 2 to 8 degrees and minus 20 degrees, we try to compute that looking at target populations, including wastage rates and we outlined it for 30 and 40 cubic meter cold room. But we have also computed that for others as well. So the recommendations in terms of if there are limited cold chain space is really ramping up that vaccination strategy, exploring distributing stocks down to the lower levels, and of course monitoring the expiry, etc., and then reviewing those shipment plans, considering absorption and expiry dates as well. Next slide, please. Yeah, so and I think that for your in terms of looking at the doses, so for up to 300,000 doses that can easily be managed by an ILR, etc. When you're looking at 1.5 million doses and upwards, 30 cubic meter cold room is sufficient, and then when you're looking at larger volumes, 40 cubic meters. So this was just a rule of thumb to help you adjust in terms of what your storage requirements are. Next slide. And we also computed the same sort of capacities for your ultra cold chain freezers for the Pfizer vaccines that are coming in as well, with the additional wastage rates too. So just wanted to make sure that we with the target population that can be vaccinated for each. So we've got the 3 most commonly used manufacturers with the models as well, so Higher, Sterling, and B Medical, and the target population that can be vaccinated from these. But I'm not going to spend too much time on this. I want to get on to the next. We only have 10 minutes. Next slide, please. Also something to stress is the temperature monitoring of the vaccines. Many of the vaccines, with I think the exception of Sinovac, they are supplied without vaccine vial monitors. So it is important that there is temperature monitoring, particularly with many of the temperature sensitive vaccines that are where electricity is an issue as well. Staff that are responsible for the handling and the vaccine packing, etc., must be sensitized to this as well. National logistics working groups, etc., should also make sure that if there are any temperature excursions and so on, that this is flagged to the NRA or the technical decision-making authority within the country as well. Next slide, please. With that, I'm going to hand over to Nora to take us through some of the experiences within PAHO. Thank you.
Good morning. Next slide, please. Thank you. I'm going to present the experiences in the Americas on how countries are managing the multiple COVID-19 vaccines in the cold chain. This slide shows the advances in COVID-19 vaccinations up to July 8th. In the Americas, 1.91 billion doses have been administered, and about 69% of the population received 2 doses. Despite challenges in the cold chain, countries managed to receive, store, and distribute 1.91 billion doses. Next. At least 15 COVID-19 vaccines are being used in the Americas across 3 different platforms. The use of multiple vaccines in every country created programmatic challenges. These challenges are related to the different storage requirements, vial presentation, shelf life, and different discarding time after vial opening. Next. The next slides will present PAHO technical assistance to member states. PAHO Immunization Unit provided technical support to 31 member states for updating the cold chain equipment inventories, estimating additional storage and transport capacities, analyzing the requirements and technical specification for refrigeration equipment, ultra-low temperature freezers, and temperature monitoring devices. PAHO received funds from the governments in Canada and United States, and also from WHO, to support and to strengthen cold chain operations, and also for the purchase of cold chain equipment. Approximately $70 million were transferred to 31 countries. Also, PAHO Immunization provided technical assistance for conducting training workshops, for estimating the additional storage and transport capacities, also in the management of ULT vaccines, freezers, and temperature monitoring devices. And also these trainings included management of medical waste at all levels. Also, PAHO provided technical assistance to 6 countries supported by COVAX Gavi for the acquisition of refrigeration equipment. These trainings conducted included the use and how to fill out the cold chain equipment inventories gap analysis and the supply chain sensing tools, and the application on submit the COVAX Gavi application. Next. This slide shows the activities that were implemented for managing COVID-19 vaccines in the cold chain. The following activities were undertaken to support the introduction of ULT vaccines, calculating the number of doses to be stored and distributed, evaluating the technical specifications of the infrastructure which comply for the installation of ULT freezers. Also, developing guidelines on the management, installation, and ULT freezers, and also on the use of PPE. Establishing a strategic distribution and vaccination sites where vaccines can be stored at ultra-low temperature. Evaluating the capacity for production of dry ice. And also another activity was the purchase of syringes and training healthcare workers on the use of low dead space syringe with a scale of 0.3 and 0.25 cc to administer Pfizer dose. Also, another activities included developing guidelines on the management and handling of ULT vaccines and other COVID-19 vaccines, conducted training workshops, and also included implementation of COVID-19 national deployment and vaccination plans. Next. Next. Okay. This slide summarizes the quantities of cold chain which have been sent to countries as of July 11, using funding from Canada and US governments. In addition, some other equipment is still in process of production and or being shipped. To date, 61% of Canadian funds and 71% of US government funds have been implemented. These funds have supported 31 countries. PAHO also received a second tranche for the government of Canada, and we are still working with countries to support for the purchase of cold chain equipment. Next. Now we're going to present countries' experiences for the deployment of COVID-19 vaccines. Next. There were challenges faced by the countries in the introduction of different COVID-19 vaccines. The challenges were introducing Pfizer vaccines with a profile which required very different handling and storage when compared to routine EPI vaccines. Also, the reception and use of various COVID-19 vaccines with different presentations like vial size, characteristics, and temperature requirements. COVID-19 vaccines have different shelf life, requiring very good inventory management. Reducing the wastage rate is affected by different vial sizes, immunization session size, different time for discarding an open vial, vaccine vial, and the hesitancy, lack of demand. And also another challenge were management information systems for maintaining product visibility at all levels. Next. Other challenges included integrating COVID-19 vaccines with the use of routine immunization vaccines. Also, another challenges were delays on the production of cold chain equipment and delays in shipments of cold chain equipment because of the lack of shipping vessels and containers. Next. The major highlights from countries' experiences are expansion of storage capacity, acquisition of ultra-low temperature freezers, training of healthcare workers in management of equipment to store ULT vaccines, including management and handling. Also assure that all vaccines arrive on time in the number of doses ordered and at the right temperatures. Acquisition of sufficient personal protective equipment and the timely approach to address misinformation, rumors for obtaining high vaccination coverage in the eligible population, also including the assured or sustained communication strategy. Next. Some of the lessons learned from countries are keep inventories of cold chain equipment up to date to identify the gaps for the additional storage and distribution capacities required, have advanced information on the characteristics, presentation, and storage temperatures of vaccines for allowing better management of cold chain and supply chain operations. Plan ahead to assure sufficient healthcare workers are available and trained. Pandemic planning requires an assessment of infrastructure, logistics, and equipment for storage and distribution of vaccines at all levels. Also, good management for developing forecasts to have timely supplies to support vaccination activities. Another lesson learned was introduced for routine use new technologies for monitoring new vaccines and also ULT vaccines. Next. Other lessons learned were keep up-to-date management inventory information system for managing inventories of vaccine and supplies to permit traceability of these products. Also, emergency plans should be updated and exercises carried out and have an estimated budget in order to assign sufficient funds in a timely manner to carry out all activities. Also, maintain permanent training of healthcare workers in the handling of new vaccines, emphasizing wastage rate reduction and monitoring shelf life of opened vial vaccines. Also, another lessons learned is to maintain a database on new cold chain equipment for improving cold chain infrastructure, and the COVID-19 pandemic provided opportunities to acquire new cold chain technologies. Thank you very much.
I think then that brings my turn. Thank you, Nora, very much for your presentation. I am Pablo from the regional office of UNICEF in Panama for the whole of Latin America and the Caribbean region. I'm going to introduce the role and the activities that UNICEF has had in terms of the fight against COVID since it started. If we can go to the next presentation in the interest of time. Yeah, I'm going to talk a bit at the general level of the region from a UNICEF point of view. Then I will dive into the cold chain equipment procurement that we have done in the Latin America and the Caribbean region. Then our role in the COVAX initiative, specifically from the cold chain equipment perspective. And then I will speak a bit about the contribution and the support from the Japan government and the vaccine stock management initiative. Next, please. Okay, so in terms of the vaccine coverage in LAC, I will not, it is very, very high level, plus Nora already gave a very good picture from the PAHO point of view. But as of May, from our recollection of data, there was like 12 billion doses administered globally, but with the peculiarity of a lot of inequities within those 12 billion doses. Specifically in the case of our region of Latin America and the Caribbean, 77% as of May of the population had received at least one dose. But then for the primary doses, it goes down to 68%, and then if we look at the booster itself, it is only 40%. Dates as of, again, as of May 2022 from our recollection. Next, please. Okay, this is a bit of a snapshot on the figures, on the numbers recorded in the region, having the worldwide situation as a reference at 67% or 2/3 of the population. We can see what I was referring to in terms of inequities in LAC. We can range from countries that are practically fully vaccinated or at least partially, like Cuba and Chile. Argentina at 90% or more. But then we can see also on the other side of the spectrum, a few countries that are 1/3 or less, like St. Vincent and the Grenadines, St. Lucia, bit less in Jamaica, 1 in 4 people, and then we can see a big country in terms of humanitarian profile like Haiti at practically nothing, 2.1%. So we can see how much it goes from practically full vaccination to practically nothing in our region. Next, please. Okay, in terms of in order to give a bit of a profile or a sizable picture of what UNICEF has done or does in terms of cold chain equipment in the region, what we do is the procurement for transport and storage of vaccines, and it comes in the form of refrigerators and freezers, like grid connected or what we call mains powered, also solar driven. Also refrigerators and freezers. We also have been taking quite a role in terms of walking cold rooms and walking freezer rooms, and then other devices that support these big ticket items like vaccine carriers, cold boxes, temperature monitoring devices, and then voltage regulators, stabilizers, etc. And then just to see how much it has changed for UNICEF in terms of cold chain equipment, I've provided a few of global and LAC figures in terms of procurement in 2019. So pre-COVID, it was around $85 million for 2.5 million estimated for LAC. In 2020, it already went global to more than 100 million, so 103.8. And in LAC, it doubled from 2.5 in 2019 to 5 million in 2020. And then in 2021, when everything, let's say, exploded, in the global picture, it was 205 million, so practically a double from the previous year. But in LAC, it was like 5 times, from $5 million to $26 million in 16 countries. And then the pictures that we can see there, they are specific to the region. And we can see that for freezers and refrigerators, it was in 2021 around $25 million. For cold boxes, $1 million. And then for vaccine carriers and temperature monitoring devices, less than $1 million. But anyway, in terms of volumes and numbers, it is quite a big one. Next, please. Okay, so as everyone may know, in terms of the role that UNICEF played, the mandate in our region is a bit specific for LAC. The mandate for vaccine itself, vaccine procurement, is within PAHO, and PAHO already presented before me the numbers around vaccination and vaccine procurement. So UNICEF, the role that UNICEF has been playing in our region has been more of a supporting one to that main role of PAHO, sorry. And then that kind of role played by UNICEF has been varying from communications, purely communications, to more active interventions. So it's been very much country by country that UNICEF has had to step in with different, let's say, supporting roles. In 2020, the main intervention of UNICEF was around PPE, personal protective equipment, and then diagnostics and therapeutics. In 2020, there was no vaccine yet, and it was a bit of a reactive mode, and everyone was trying to position and try to size the magnitude of COVID. Then in 2021, together with this supporting role to the vaccination that I mentioned, UNICEF was increasingly called for auxiliary products to the whole vaccination cycle. So syringes, safety boxes, vaccine carriers, cold rooms, etc. And then this COVID for us has been a bit of an entry point in many countries in terms of giving visibility to governments on the possibilities to strengthen their supplies, their health systems, sorry, and to influence national cold chains, including oxygen. So that's been a bit of an entry point for us in some of the countries from a health perspective. Next, please. Okay, so in terms specifically of the COVAX intervention from UNICEF, it's been supporting the procurement of cold chain equipment in 6 AMC countries, and we have them here: Bolivia, Salvador, Guyana, Haiti, Honduras, and Nicaragua, for a total of $1.2 million allocated through the Gavi funding. And the areas of support, it is a bit repetitive with what I already said, has been around the procurement of cold rooms, remote temperature devices, refrigerators, freezers, and other cold chain packaging systems. So nothing new here. If we can go to the next, please. This is just an example. We have featured the intervention in Honduras, which is one of the 6 AMC countries that I mentioned in the previous slide. So it's been at national level. We have strengthened 18 national warehouses through the procurement of 18 refrigerators and 8 freezers. Together with the national level interventions, also the primary healthcare infrastructure has been reinforced in this country through the procurement of almost 1,500 vaccine carriers and more than 5,000 freezer packs. Together with this, 1,289 temperature monitoring devices, a couple of million vaccine cards, and 80,000 certificates, COVID certificates, and 7,000, possibly much more by now, alcohol gels. So this is just to give a bit of the size of a country like Honduras. Next, please. This is just to continue with the Honduras case, a couple of pictures. The one in the left is about the transportation of refrigerated trucks from Tegucigalpa to San Pedro Sula. The transport has been about 1.5 million doses of vaccines through the COVAX mechanism. And the picture in the right is from a vaccination center where there's a girl and her mother getting vaccinated. Next, please. We dive now into the Japan contribution. The government of Japan has been increasingly significant for our region in terms of their support since 2020 in the framework of the COVID response. In 2021, they were actually the 3rd largest donor after the US and the European Union in terms of direct contributions to the region. Their role has been very large in terms of support to health, focusing, of course, on the COVID-19 vaccine rollout and the cold chain strengthening, but also together with that one, that support has dived a lot into regular immunization and health system strengthening, like general health system strengthening in a number of geographies, like, for example, you can see it here, Venezuela, Haiti, and Cuba. And then they've been a strong partner, not only in terms of the COVID response, also other general emergency response efforts they have been supporting in our region with a very special focus in WASH. And since 2020, as I was saying before, in 2020, to be exact, it was the ETA and IOTA hurricanes response, and then in 2021, it was the Haiti earthquake. Next, please. This is a bit of the profile of their support. It's been, if you count, more than 21 million. It's been 13 countries. There was a first contribution for 11.11 million to 6 of our countries. That was in May 21. That worked out so well that then there was a second edition, we could say, in 2022, less than a year after, for another 7 countries for 10 million. So it's strengthened a lot the collaboration and the support of Japan in our region, and this is not just it. I mean, it will continue, we are sure. Next, please. Yeah, I mean the key activities supported by Japan. I mean, I will not read it all, just in the interest of time, but it's been from procurement and installation of cold chain and ultra cold chain. For also to passive containers, temperature monitoring, equipment and maintenance and voltage stabilizers, generators, and also the generators, which in our region is very relevant in terms of reaching rural areas. And then the logistics itself, so refrigerated vehicles for vaccine distribution, and then other small scale activities in the cold chain management. Next, please. I will finish with this point, which is a bit of an overview of the vaccine stock management initiative that we have had in our region. We've had a regional level and then a country level. At regional level, there was a resource hired for information management in order to conduct specific country evaluations and assessments on vaccine stock management systems. Based on this, let's say, consultancy on the activity of this hired resource, there's a mapping exercise and recommendations being elaborated on how to improve and optimize the digital systems for stock management and registry. That is pan-regional level, let's say. Then at specifically country level, we have had 3 vaccine stock management experts deployed to countries, specifically Haiti and Guyana, to help those countries with improvements on their stock management initiatives and systems. Also, in El Salvador, there's another resource being recruited for similar activities, for similar support. Next, please. That would be it from my side. Thank you very much.
Thank you, Pablo. The next presentation should be presented by our guest from Nicaragua, but I think he has had some last-minute issues and cannot join. My question is, can someone from our panelists present? Are you comfortable with the content? Have you had the time to see it? It would be in Spanish, Nora, perhaps, but if you haven't had the time to look at the presentation, you can decline, of course.
Yeah, I can go ahead, but I'm going to present in Spanish.
Of course.
The presentation is in Spanish, and we have translators, interpreters, so I can take it. Thank you.
Yes, so we're going to, yes, the interpreter is going to cover you. Thank you.
Ok, bueno, voy a presentar las experiencias de Nicaragua sobre las estrategias para optimizar la distribución y el uso de las vacunas, y con todo el permiso del gobierno de Nicaragua voy a hacer la presentación en nombre de ellos. Siguiente. En cuanto a la introducción, el gobierno de Nicaragua hizo todo un despliegue para vacunar contra la COVID-19. Tuvieron muchos retos en cuanto a las nuevas vacunas, a las nuevas tecnologías, en cuanto a la producción de estas vacunas que tenían diferentes presentaciones, también la parte de los requerimientos de almacenamiento, distribución y la disponibilidad simultánea de diferentes tipos de vacuna para vacunar a diferentes grupos poblacionales tradicionales en cuanto a lo que se ha venido haciendo en el programa de rutina. También se debió atender la demanda de la población con un abastecimiento limitado, la pandemia en el país en fase aguda, capacitación y entrenamiento del personal en todos los niveles. Se desarrolló un sistema nominal, una campaña de comunicación para generar demanda responsable y promover el cuidado, distribución de la vacuna en todos los niveles. Segunda, siguiente. Siguiente. En cuanto al plan de despliegue de la vacunación contra la COVID-19, tuvo unos objetivos generales y unos objetivos específicos. En cuanto al objetivo general, era contribuir al control de la pandemia con la COVID-19 a nivel nacional a través de una vacunación basada en el marco de valores de grupo de expertos en asesoramiento estratégico en inmunización, SAGE y el análisis epidemiológico nacional. En cuanto a los objetivos específicos, estuvieron enfocados en la primera fase, reducir la mortalidad específica por COVID-19, también reducir la incidencia de casos graves de COVID-19, como también proteger el talento humano en salud. Los objetivos en la segunda fase contaron básicamente con la reducción del contagio. Siguiente. Uno de los objetivos era entonces priorización de la población a proteger. Entonces se tenía el primer abastecimiento en cuanto a las vacunas contra la COVID-19 que fueron recibidas en marzo de 2021 y se miraba entonces diferentes etapas en cuanto a la administración de la vacuna. Estuvo enfocada entonces en una población a vacunar de 18 a 49 años, embarazadas y lactantes y población de 2 a 17 años. También se miraba en cuanto, estoy leyendo, perdón, vuelvo, corrijo porque viene de abajo para arriba. La primera etapa entonces se contó la vacunación al personal de la población con enfermedades crónicas de base, enfermedad renal crónica, cardiopatías oncológicos y adultos mayores de 60 años, como también el personal de salud de primera línea. La segunda etapa contó entonces en la vacunación para adultos entre los 50 y a los 59 años, personal de trabajos esenciales, y la tercera y cuarta etapa contó para la vacunación a la población aquella entre los 19 y 49 años, embarazadas y lactantes y población entre 2 y 17 años. Siguiente. Siguiente. Ok. En cuanto a las estrategias de vacunación implementada, entonces estuvieron enfocadas en el bajo volumen de dosis establecidas, implementaron un equipo nacional de vacunación, el cual estuvo bajo un cronograma movilizado a los 19 SILAIs, que son los departamentos que tiene Nicaragua, y a 153 municipios, integrado por un coordinador general y 10 brigadas. También se tuvo una responsabilidad en la parte de digitar todos los registros de las personas vacunadas y también todo lo que tenía que ver en cuanto a la vigilancia de posibles eventos adversos. Otro punto en cuanto a estas estrategias implementadas era cuando hubo mayor abastecimiento de dosis en cuanto a tipo de vacuna, esquema de aplicación y fechas de vencimiento de la vacuna entregada. Desde octubre 2021 se implementó una vacunación intensiva que incluía horario nocturno y fines de semana. Estas actividades incluyeron vacunación intramuro a los servicios de salud, de atención primaria y secundaria, como también vacunación extramuros, casa a casa y también brigadas en puestos fijos y móviles. Siguiente. Uno de los puntos importantes en todo este proceso fue el fortalecimiento de la cadena de frío para una distribución con calidad. Yo veo que el doctor Leonardo Pealta ya se conectó, entonces con todo el respeto, si ustedes me permiten la audiencia, vamos a cederle la palabra al doctor Pealta para que continúe con su presentación. Muchas gracias y bienvenido, doctor Pealta. La palabra es suya. Puede abrir su micrófono. Gracias.
Sí, muy buenos días. La verdad es que tuvimos un problema ahí de conexión. Mis disculpas a todos. Con la presentación del día de hoy, número 6, a realidad. Bueno. Mucho gusto a todos. Mi nombre es Leonardo Pealta. Soy el director de prevención de enfermedades del Ministerio de Salud de aquí de Nicaragua. La verdad es que en Nicaragua ha sido un avance importante en lo que es la vacunación debido a las diferentes estrategias de despliegue que hemos tenido y de la misma aplicación de la vacuna en el país, ¿verdad? Siempre he contado con el apoyo de algunos organismos internacionales para la adquisición de vacunas, así también como los fondos para poder desplazar brigadas a zonas especiales de lejano lugar para poder así nosotros garantizar la vacunación en estas zonas de muy difícil acceso. El fortalecimiento de la cadena de frío es una parte fundamental e importante y esencial en el despliegue de la vacunación y en el Plan Nacional de Vacunación. Pudimos contar con el apoyo de equipos de ultra baja temperatura para el almacenamiento de vacunas a ultra baja temperatura, así como vehículos refrigerados para el transporte de esta vacuna a los diferentes departamentos del país. Actualmente se encuentra en su fase final la construcción de un banco biológico en la ciudad capital de Managua, que viene a fortalecer aún más de la red o la cadena de frío a nivel de almacenamiento de vacunas en el país. Una consulta nada más. La presentación la están dirigiendo desde ahí. No sé si podemos pasar a la siguiente lámina, por favor.
Yes, please go ahead.
Sí, doctor, usted solamente indica siguiente. Gracias.
Ok, siguiente. De acuerdo. Entonces, nosotros ahí podemos observar una donación importante del país hermano de Japón, ¿verdad? Con equipos de cadena de frío a través de UNICEF, ¿verdad? Y podemos observar también ahí en la lámina parte de nuestros equipos nacionales de almacenamiento de vacunas, el cual garantizan una correcta cadena de frío para el poder nosotros garantizar la calidad de la vacuna y su posterior desplazamiento a los diferentes departamentos en el país. Se establecieron 3 rutas de despliegue de vacunación. La primera ruta que comprendía los departamentos de la zona central y la zona de la costa Caribe Sur de Nicaragua, en el caso de Chontales, Celaya, Río San Juan y la parte de Bluefield, ¿verdad? En la que es la costa Caribe. Una segunda ruta que se estableció en la parte del Pacífico de Nicaragua, en los departamentos de Masaya, Granada, Rivas, Carazo y el mismo Managua. Y la siguiente ruta que comprendió los departamentos del norte del país como Matagalpa, Estelí, Madrid y la parte de la costa Caribe también norte. Siguiente, por favor. Sí, aquí nosotros podemos observar algunas láminas de las acciones y las estrategias que nosotros como país nos implementamos y nos propusimos para tener un importante avance en la cobertura de vacunación. Nosotros podemos observar algunas zonas especiales de nuestro país en el cual se desplazaron brigadas móviles, ¿verdad? En caballo, en bestias, a pie, visitas casa a casa, ¿verdad? Y esto pudo permitir que tuviéramos un avance importante en la cobertura de vacunación, tanto de primera dosis como esquemas completos. En la parte de arriba podemos observar parte de las brigadas móviles que se desplazó en una primera etapa, en una primera etapa de vacunación, en el cual consistió en la conformación de un equipo nacional de conducción que dirigió esta brigada. Estas brigadas a su vez contaban con un coordinador general, el cual se desplazaron por diferentes partes del país, priorizando grupos, ¿verdad?, de vacunación en el caso de los adultos mayores, personas con enfermedades crónicas, embarazadas en un principio también y posteriormente, ¿verdad? En una segunda etapa ya con personas de menor edad. Aquí nosotros podemos observar también después de que al finalizar estas etapas se estableció la estrategia de vacuna en todas las unidades de salud, ¿verdad? Y ya después se desplazaban todos los equipos y todas las personas, el personal de salud de todas las diferentes unidades de salud a visitar a las personas hasta sus hogares, visitando casa a casa y garantizando la vacunación, ¿verdad? Tanto a los niños como jóvenes, adultos mayores, ¿verdad? Y eso nos ha permitido a nosotros poder tener un avance importante en nuestras coberturas y completando nuestros esquemas de vacunación. Siguiente, por favor. Y bueno, esto igualmente es parte de nuestras acciones, nuestras estrategias que nos pusimos nosotros como país, ¿verdad? Ahí podemos observar una cantidad importante también en una de las láminas de estudiantes de enfermería, incluso de las enfermedades de las universidades, en el cual también formaron parte del grupo de apoyo de las brigadas nacionales de vacunación, ¿verdad? Entonces, previamente capacitados, ¿verdad? Y también tenemos parte del desplazamiento de lo que son estas brigadas a través de pangas, botes, lanchas, a los diferentes lugares de difícil acceso de nuestro país, ¿verdad? Aquí abajo podemos observar una lámina donde tenemos puestos de vacunación móviles y fijos. Fijos son las unidades de salud, llámese puestos de salud, centros de salud, hospitales, clínicas médicas previsionales, y los móviles son porque se desplazan, ¿verdad? En diferentes comunidades o barrios, ¿verdad? Garantizando esta vacuna a toda la población, ¿verdad? Entonces, nuevamente mis disculpas. Espero que la parte inicial de la presentación también haya quedado un poquito clara. Si tienen algunas preguntas, pues estamos aquí para aclararlas y para explicar un poquito más acerca de nuestro Plan Nacional de Vacunación, despliegue para una optimización de la vacuna contra la COVID-19. Cambio.
Thank you very much, Dr. Pealta. There are like a few questions. Dr. Pealta, are you comfortable if I ask you in English? Well, there's a...
It's easy in Spanish, please.
Lo voy a intentar, pero es difícil para mí.
De acuerdo.
Oh, muy difícil. Okay. Perhaps, Nora, perhaps could you translate for me?
Sí, gracias. Hay una pregunta, doctor Pealta, en cuanto a su presentación, y es mientras que se llevaba la vacunación en las áreas rurales en Nicaragua, dice que la experiencia del equipo de vacunación, que si hay alguna parte de la resiliencia en la comunidad para recibir la vacuna, y si es así, ¿cómo estos equipos de vacunación manejaron esta parte?
Ok, sí. Al principio de la vacunación, al tener nosotros una cantidad muy inferior comparado al resto de los países del mundo, ¿verdad? Y con la pandemia, como dicen, en su máxima expresión, tuvimos una demanda muy importante de vacuna en abril del año 2020. Entonces, por eso fue que nosotros nos establecimos en etapas esta vacunación, priorizando los grupos entre las enfermedades crónicas, los pacientes adultos mayores de 50 y 60 años. Entonces, lógicamente, la demanda de la vacuna era importante y entonces tuvimos que establecer estos grupos priorizados. Posteriormente, al avance de los meses, tuvimos una importante donación de países, de los diferentes países del mundo de vacunas, lo cual hicieron o nos permitieron a nosotros aumentar nuestra cobertura hacia otros grupos poblacionales en el país. Sin embargo, llegamos a un punto en que ya la vacunación estuvo, como dicen, disponible para el 100% de la población, y sin embargo, siempre queda un grupo menor de población renuente completamente a la vacuna o a la vacunación contra la COVID-19 por diferentes, pero no en un porcentaje alto. Hay un porcentaje de 5% de la población general en el cual rehúsa completamente la aplicación de la vacuna, sobre todo en las áreas indígenas de nuestro país, en la costa caribe, sur y norte, en el cual ellos manifiestan diferentes inconformidades. Entonces, esa renuencia a la vacunación hemos tratado nosotros de incidir con diferentes estrategias, ¿verdad? Sensibilizando, haciendo talleres, incluso tenemos un taller actualmente en proceso con apoyo de OPS, taller de diálogo de saberes para los pueblos indígenas, para fomentar lo que es la vacunación contra la COVID-19, y de esta manera hemos podido alcanzar porcentaje importante también en estos grupos que son renuentes completamente a la vacunación.
Muchas gracias.
Thank you. There's a question for Nora. Nora, in one of your slides, it said the information of vaccine administered, which are at a considerable quantity, ranked right after Pfizer, are not available. Would you be able to explain more on this, please?
This was for me.
Yeah, this one was actually asked during your presentation. Yes. Maybe it was. If you can't answer that one, we can skip it. Don't worry.
Yes. Yeah. Well, I don't remember, but that part is part of my presentation. However, the first vaccines that the Americans received were Pfizer. That also, to highlight, that was the first vaccine that was approved by WHO as emergency use. However, countries established different alternative agreements with manufacturers. So that's probably the explanation of why Pfizer vaccine is the first vaccine and in a high number of doses administered at the beginning. Yeah, probably is one of my second slide, that is the different COVID-19 vaccines, the 15. Yeah, I don't know if that answered the question to the person that was asking, but that is the reason.
Okay, thank you very much, Nora. We've reached the end of this webinar. Actually, we're 2 minutes past the end time. So thank you very much to all panelists, and thank you, Dr. Pealta, for trying really hard to connect. I understand it was a little problematic. We will share the recordings and the slides by email probably early next week. In the meantime, we wish you all a very pleasant day, and thank you again to all panelists. This was a very, very interesting presentation. Have a nice day, everyone. Bye.
Bye, thank you.
Yes.
Thank you.
Thank you.
Hasta luego. Bye.